You know, we are almost 5 years into this EHR contract, and from the very start, before the original Cerner contract was even agreed to by the Trump administration, I have been raising concerns from my constituents in Spokane and in Walla Walla, and I believe that I have been very patient and reasonable in pressing the VA and Oracle Cerner to get this system to work the way it should. Now, I have heard from providers who are now burnt out trying to navigate this broken interface on top of what has already been an incredibly trying time for healthcare workers. And I have heard directly from my constituents who have received a late cancer diagnosis because of the flaws in the system and everything in between. None of this is okay. And something that concerns me deeply is we have not heard a lot about how those voices, that on-the-ground perspective, will be taken into account when we determine the future of this program. VA is now in the decision-making process about whether to renew this contract. This is a key moment. So, Dr. Elnahal, I need to know who is representing the front-line experience from Eastern Washington who's been using this system, and how exactly is the patient and provider experience represented in that decision-making?
I think it's a really important question, Senator, and we focus squarely on that in the sprint effort in collaboration with the program. We built a governance structure that takes the views of end users into consideration in the first instance. The most important input we have is the input we have from frontline clinicians like Dr. Evans, who are telling us about the problems that need to be fixed to meet the veteran care need. That cascades up into different levels of governance, our clinical councils, that ultimately make decisions on the changes we need to be able to meet
so
safe
it isn't
and effective
the users who've been facing these challenges over and over again?
Yes, our governance now includes users from the 5 sites where it exists and leaders who are advising on what changes need to be made based on their input.
Okay, well, I'd like to see that chart.
Absolutely, Senator.
Mr. Cecilia, Mann Grandstaff has been dealing with serious and even life-threatening issues for over 2 years now, since the rollout of the EHR. And many of the OIG reports have further confirmed what I have been hearing on the ground over and over. There are problems in the system with suicide flags, with unknown queues, pharmacy issues, and I know that Oracle has begun working on some of those fixes, but we are still talking about the same problems 2 years later, and that is just so unacceptable. The stakes are really, they couldn't be any higher. So just tell me, why is it taking so long to update this system when we've been telling you the problems and, you know, from the ground up 2 years ago, and we're still getting the, well, we're going to have a fix for this?
Well, thank you for the question, Senator. To my knowledge, the unknown queue issue has been addressed. I committed to this panel in July that we would deliver a fix on August 1st of 2022. We did that. It is deployed, and now, on average, there is 1 order per day that shows up per site in the unknown queue. I think the last time we spoke here, we were up about 1,500 orders in the unknown queue. So if that is still a problem, that is in fact news to me, and I'm happy to come back to you in writing if there are additional problems, but I've not heard those. In terms of pharmacy, the last time we spoke, the estimate was that it would take 3 years to address the pharmacy's issues. My response to that was, when that kind of estimate is given, the real answer is nobody knows. So the first thing we did after that hearing in July was broke that down into smaller subsets. We delivered in February the top 3 fixes for pharmacy. The 4th fix, number 4 on the priority list, will be delivered in April to the VA. As Dr. Evans just mentioned, we have heard some positive feedback from sites about those pharmacy fixes. As far as behavioral health flags are now in the system and will continue to be added to all modules of the system on schedule in April. As well, the opioid advisor tool that has been deployed has flagged over 1,600, just at the 5 sites that are live, has flagged over 1,600 potential opioid prescriptions that would have been made to patients who perhaps should not have received opioids. So I think a lot of the issues that have been reported have been addressed. I'm disappointed to hear that news has not made it to you, and certainly we will make sure that we respond in writing with affirmative data on each one of your questions.
I would like to see that in writing. Mr. Chairman, but before I finish my time, I just want to say, as chair of the Appropriations Committee, and Chair of the Military Construction and Veterans Affairs Subcommittee, and a longtime member of this committee, I take my oversight responsibility pretty darn serious. And despite how much funding has been provided, this system is by no means living up to our promise to care for our veterans. The continued patient safety risks are totally unacceptable. So I want to be candid here, because at the end of the day, what I care about is getting this right for our veterans. And I do not believe that more money is what is going to solve this problem. And I'm not sure it makes sense, Mr. Chairman, to continue to fully fund the budget request for this system until I can see that the system is working and not putting our veterans in harm's way. That responsibility is on both the VA and Oracle Cerner, and both entities need to step up.